Alright, so this is Dr. Katzen, and today we're going to be talking about the Permalip. Basically, it comes in three different sizes, basically small, medium, and large. It's a 3mm, 4mm, and 5mm. It also comes in different lengths. It's permanent, it's made of silicone, it's nice and soft, okay? It doesn't feel sort of like a hard brick in your lip. It's nice and soft, so I'll have Killian feel those. That's the largest implant. Just kind of bring it up against your lip there. And that's where it will be. What we'll do is we'll just put it underneath the surface of the skin, and on Killian I think we'll do an incision, one incision in each corner of the mouth, and from that incision I'm able to make a tunnel and put that implant in. These are permanent implants, FDA approved, so they should last your lifetime. The nice thing about it is you don't have to keep coming back for injections and lip fillers. This is a permanent solution to augment the lips.
Hi, my name is Killian Wells. I am a pop music artist and owner of the perfume company Xyrena.
So the insertion of the Permalip is an in-office procedure. It takes about 30 minutes. You're able to go back to work that same day if you want. Lips are going to be a little bit swollen, or definitely by the next day.
I chose to go with Dr. Katzen because after meeting with him and seeing his work, as compared to the work of some other doctors that have done Permalip, I was confident in his surgical technique in putting the implant closer to the muscle, between the muscle and the soft tissue of the lips, because some Permalip results that I've seen from other doctors looks it's too close to the skin and looks almost like a worm.
Open it, open wide, very good. So this is just a little betadine. This sterilizes all the skin around our surgical area here. Gets it all nice and super clean. A little numbing medication. How you doing?
Pretty good.
Good. It's like the dentist, huh? I won't ask you too many questions. So that's the numbing. And then we're just going to re-sterilize everything again.
I can still feel a little bit of my lip right here.
Yeah, you'll feel it, but it should be good and numb.
Okay. Yeah, it's kind of just like a tingly.
Yeah, you'll feel me, it's kind of weird. You'll feel me working, but it shouldn't be painful. It'll feel kind of like foreign, it'll feel like just numb.
I don't know why, but I like the smell of betadine.
You do?
And betadine.
Yeah, I don't know why. That's a little different. Maybe a new fragrance line, right? Another one in this corner. About a 1/2 centimeter is the size of the incision. Just open up the hole a little tiny bit. Now I'm making my little tunnel for the Permalip with this little cannula. And now I'm coming to the other side. And now I'm going to come in with my curved alligator clamp. This is the special little clamp that we come in with. And I carefully follow the curvature of the lip, and now I'm right on top of the muscles that go to the lip, and I'm underneath the soft tissue of the lip to make it look more natural. Right about to pop out in the corner here. There we go. Alright. So now I have my curved alligator clamp, and we passed it just underneath the lip tissue but above the lip muscle. I'm going to open up my clamp and drag my implant through. So I put a little bit of extra betadine to further sterilize this lip implant, and now I'm just going to drag it through. So there I've grasped the implant, and I'm pulling it through. Now you can see that we have the implant on both sides. So what I like to do is I like to rock it back and forth to make sure it's nice and centered. And then we sort of pop it into the lip. And you'll feel it just sort of pop into place. So now I just make sure it's nice and even and centered correctly. It's going to look a little swollen and a little uneven. That's just because of the local anesthetic in there. But I can feel it's nice and even on this side and nice and even on the other side. So basically I'm just doing the upper now and enlarging my entrance holes for the upper lip. And then we're going to put in our special curved alligator clamp. When you do this, you want to just go down to the muscle and just ride right on top of the muscle. And I'm just slowly advancing the tissue over the top of the alligator clamp here. It's a gentle pressure, but you can see the patient's completely numb. They barely feel anything. I got a thumbs up down there. Good day at the spa, is what Killian said here. So now we've just come out on the upper lip with our alligator clamp. So go down all the way through. Clamp the implant here, and now I'm just going to clamp on it, and I'm going to drag it through the upper lip, and you can see the implant coming through nicely. Just want to let it guide through, and then you can see this is the end of the implant on this side and on the other side. Now we just want to rock it in place, make sure it's right in the middle. Good. And then we pop it in place like so. And then massage it as we need to get nice symmetry. So we don't see any of the corners of the implant sticking out, so we don't have to trim anything off. Everything looks really good. Good. So the only thing to avoid first couple of days, just any really hot soup or maybe hot coffee. Maybe you could burn your lip. I've never seen or heard of one, but conceptually maybe. But that's about it. You're going to be swollen from the surgery. You're going to be swollen from the anesthetic. That will go down. Okay. And what we see now is just a little bit of the swelling starting to kick in. And good. 1, 2, 3. Boom. Very good. Excellent. Good. You did it. Yay. Yeah. All right. Very good. So now we'll do. Thank you very much for watching Transformation Tuesday with me, Dr. Katzen. Every week we upload a YouTube video, so please watch us next week and subscribe to our YouTube video. So if you're looking for a transformation, big or small, please give us a call, and we look forward to seeing you next week. Thank you.